I'm Dr. Sharda Jain. Today I'm going to speak on near miss cases and maternal mortality in India. It is awesome day that we want to start monthly meeting of near miss cases. So more and more people know about the intricacies of these cases, how they were saved, and more lives can be saved. Ladies and gentlemen, distinguished gynecologist, I stand before you today to underscore the significance of a topic that is often overshadowed by the celebration of a birth of a child. The life which has been saved during this process of delivery gets ignored. That is near miss cases in gynecology. As we gather here to initiate this monthly meeting dedicated to this subject, I want to emphasize that every mother life is invaluable. It matters. And it is our collective responsibility to ensure their well-being. I believe that in sharing the knowledge and understanding, we reduce the number of near miss cases and ultimately save lives. Before I get on to serious business, I will speak a couple of points which each one of you must remember. In India, maternal mortality is unacceptably high, with approximately 9 to 10 deaths per 1,000 live births happening in 2023. In the last 10 years, there had been a significant drop, but we have to go long way. Maternal near miss cases far outnumber maternal mortality cases. For every maternal death, there can be as many as 20 near miss cases. The ones who survive are never normal. कुछ ना कुछ तो कमजोरी रह ही जाती है उनकी. Hemorrhage is the leading cause of near miss cases in India. Lack of access to skilled Medicare in remote areas contribute to near miss cases. Now the government of India has made it almost mandatory that they should come and deliver in primary health center and not deliver at home. Still, about 10% are still not delivering at home. But the expertise is probably not that good. But I'm a great believer, even if the nurses deliver, they will save the lives of the patient. Delayed recognition of complication is a major challenge. And that is why Delhi Gynecologist Forum, North India Gynecologist Forum insist that every postgraduate gynecologist, MD and DGO, must do a critical care course in obstetrics to know early recognition of complication, so timely action can be taken. Multidisciplinary teamwork is crucial for managing near miss cases effectively. 15% are bound to have complications, and out of this, 3 to 4% become severe, and there you require multidisciplinary team approach. Poor nutrition and anemia, which is rampant in our country, contributes to near miss cases in a big way. If the lady's hemoglobin is compromised, she will not be able to face that distress of hemorrhage. Inadequate antenatal care leads to complication during childbirth. It's okay that the deliveries are taking place in primary health center where at least nurses are there. But antenatal care, probably we have to put a little more focus and aim that at the time of delivery, the hemoglobin should be 11 gram% or more. Cesarean section can be lifesaver in some cases, but can lead to near miss cases if it is done by inexperienced hands. And a proper facilities are not available for cesarean section. Hypertensive disorders are again significant risk during pregnancy, after hemorrhage and postpartum hemorrhage. And here one has to see that severe form of PET and eclampsia should not occur. Because if she throws a fits, her mortality increases 10 times. And if there are 10 to 12 complications which can happen in severe eclampsia and eclampsia cases, and those complications have to be early diagnosed before they can do harm to the life of a patient. Adolescent births often result in a near miss cases due to underdeveloped organs, and nearly 20% of total births occur in girls who are less than 20 years. Postpartum hemorrhage is a common near miss event. 25% of total maternal deaths are caused by postpartum hemorrhage, and in another 15-20% cases, near miss cases happen, where all effort of the team can save their life, but they will require a lot of postpartum care. Infections have become markedly less in our country, but still, when the sepsis occurs, it's of critical concern, and each gynecologist, each nurse should know the septic bundle to be used timely to avoid near miss cases in such situations. Poorly managed miss cases. Socioeconomic disparities contribute in a very big way to the burden of near miss cases. When the timely they are not referred to a place where all facilities are available for emergency obstetric care. Poor access to emergency obstetric care in rural areas lead to near miss cases, and I think we must work out a proper transport for these emergency patients. It is said once the emergency arises, within 2 hours they should be there in a theater of setup which is well equipped to save the lives of these patients. Education and awareness among healthcare providers can help to prevent near miss cases. All nurses, all paramedic staff, and through them, the awareness should go in the masses, that 15% of low risk cases also can develop into high risk and pose problem to the life of the patient. As we begin our monthly meetings on near miss cases, it is crucial that we not only discuss these facts, but also work towards actionable solutions, positive solutions, how to save lives. By learning from each other about their near miss cases, we can improve our clinical practices, enhance the healthcare system, and ultimately save more lives. Let us remember that every mother's life is important. Let this initiative be the testament to our commitment to the health and well-being of a woman in North India. Together, we can make significant impact on reducing near miss cases and ensuring safer pregnancies and deliveries of our fellow citizens. Thank you very much for your attention. I look forward to very productive discussions and collaborations in coming months. Thank you very much.